Good evening, Glenwood Springs. We are live for our community conversation. My name is Janess Brewer, and I'll be your facilitator for tonight's community conversation about how to balance public health and the reopening of the economy during the COVID-19 pandemic. This session is designed to be interactive, so Glenwood Springs residents can hear from each other, even in this time of social distancing. People have the ability to call in by telephone, in Spanish or in English, and to participate online. And we can see there's a good number of people who have already tuned in. For those of us in the driver's seat with BroadNet, it looks a little like mission control here at NASA. So thanks in advance for your patience. We're all learning new things in the era of coronavirus. I have a handful of slides that I will share more about how we'll spend our time tonight. Let's go ahead and go to slide 1. So again, this is the first of 3 conversations. Welcome to it. Look to repeat this if it's successful and to improve upon it in the next couple of months. Next slide. So here's the breakdown for how we're going to spend our time tonight. You can see after some brief opening comments from your fellow community members that we'll then have a presentation from Public Health and Valley View Hospital. This will be brief. In about 12 minutes, they'll share all the latest and greatest of what we need to understand in terms of the pandemic. And then we're going to shift to all of you and really spend the bulk of our time hearing from the residents of Glenwood Springs and really to understand more of your questions, ensure that any of the panel participants are able to answer those questions as best of their ability, and then additionally to have public comment. So if there are things you particularly want the city to know, your fellow residents, your neighbors, that will be the opportunity. We'll then end with some closing comments and then finally adjourn around 7 o'clock. Next slide. So hopefully this is the conversation that you're tuning in for and the one you were hoping for. So I facilitate a lot of different meetings, and this one is really about finding that sweet spot of reopening. So where you're balancing both public health and the economy, and where's that sort of sweet spot for Glenwood Springs? Next slide. So as I mentioned, I facilitate a lot of meetings where the goal is something different than this conversation, where the goal is to reach consensus on a thorny issue. People have to collaborate, they have to work by consensus. The good news is that's actually not tonight's conversation. So I hope everybody can sort of take a step back from that, take the pressure off thinking we need to reach a final agreement. The goal of the conversation tonight is really to have a listening session and to seek understanding as best we can. So, so with a focus on listening, I always say my grandma is Adele, and she always said, Janess, you've got 2 ears and 1 mouth. Use them proportionally in these kinds of conversations. And so that's what we'll do. We're looking forward to having a really respectful exchange of ideas tonight, and hopefully a fair amount of curious questions as we try to collectively, as a community, wrap our hands around these issues. Now, many people are likely streaming this online. If that's the case for you, then you are going to be able to submit your questions below the streaming player. If you're listening in by telephone, you can see here the instructions, which is press *3 into your keypad to enter into the question queue. You can do this at any time tonight, but as a reminder, we do have some opening comments. We are going to hear an opening presentation or update in terms of the latest public health data, and so that might be a helpful backdrop to inspire some additional dialogue. Let's see, and then just lastly, I would say on that slide too, if neither of those are quite your speed, so if you're not wanting to sort of tune in this kind of public forum, you want to listen but not participate, we have a really nice community website at www.gwscommunityconversations.com. And there's a community bulletin board, and people have been posting, gosh, I have a question about this, or, I'm really been thinking through how do we communicate with the visitors in our community? And here's an idea. And so there's the place to do that. Next slide. So you all know this in terms of we have an esteemed group of leaders from both small and larger businesses here with us today from Glenwood Springs. We've got public health and the community hospital represented. We have Beatrix, who is here to represent the Latinx perspective. And again, she's not expected to represent everyone in the community, but give us really some perspectives to think about in that regard. We have friends groups, associations, and a participant from City Council who are here and ready to share their perspectives in either the opening comments, as you can see, or to listen and reflect on the dialogue and share some closing reflections or comments toward the end of the meeting. I will say, though, I will have the ability, and we can direct questions to any one of these speakers. So even if they haven't spoken early in the meeting, there might be a question that really pops up for a small business owner, and we'll want to turn to Aaron Zielinski for an answer or perspective. So that's just an example. Next slide. So importantly, I want to touch on the issues of authorities and decision making, because I know already in your community there's been a lot of discussion about that. And so we've created this chart, or I should say Glenwood Springs, the city of Glenwood Springs has created this chart to help provide more information in that regard. There's a slightly more involved version that's on the meeting materials tab on the website that I've already mentioned. So if you're interested in that, that's where to find it. But here's kind of the takeaway from this chart, which is Governor Polis has the most far-reaching authority in Colorado during this pandemic. And then next is Garfield County, to which you are a party to, can then choose to be more restrictive on any given issue. But they can never choose to be less restrictive unless they apply for a variance, in which case the state would need to approve that. Then, sort of moving down the spectrum, Glenwood Springs can then do the same. They can be more restrictive than Garfield County, but not less. And so I thought this might be helpful in terms of a backdrop for tonight's conversation. Next slide. So let's go ahead and get started. As a reminder, here's how to find yourself in the queue if you have a question or a comment. And so again, press star 3 on your keypad if you're on the telephone. If you're streaming online, you can see where to submit that question under the streaming player. Or if you want to just engage quietly and sort of have it there on the record, you can do that also on the gwscommunityconversations.com. Okay, perfect. We've closed out the slides, and let me go ahead and turn it over to the first of 4 people who are going to provide some opening comments for us. I'm going to turn to Angie Anderson, who's the CEO of the Glenwood Springs Chamber Resort Association. And Angie, if you want to, let's see, we've got about 2 minutes before my phone will start to buzz at me, and we need to move on to the next set of opening comments. So let me kick it over to you.
Okay, thank you very much for the opportunity to be here tonight. I think when your name starts with A, you often get to be the first person. So I just want to acknowledge that where we are right now, where we've come from, this pandemic, as we've been dealing with for about 3 months, has been really difficult. It's been difficult on our businesses, on our residents. And I just want to thank everybody for all that they've done to get us to this place. Initially it was trying to get information out and trying to share what was happening. A lot was happening all at once. And so we did our best to get that information out. And now we're at a place, and we're grateful to be open, and we certainly want to stay that way. So I'm excited to hear what people have to say tonight and engage in this conversation. But just really want to acknowledge our businesses, and since I do represent that area of the community. They've had to make some tough decisions, but they've really rallied and they've pivoted and they've worked really hard to be able to open and safely welcome back visitors and community members into their places of business. So just want to really thank them and acknowledge them for all of that hard work. And just want to reiterate that we want to stay open, and as a community, how can we work together and collaborate as we have for these past 3 months? I don't think we would have even been to the point of reopening had we not worked so hard together, and hope that continues that way. And we're just grateful to be open and welcoming our visitors. We're, as a destination marketing organization, of course, we are responsible for messaging to the visitors, and we are doing so responsibly. We want to, again, just communicate to those visitors what to expect when they come here, and then we want to welcome them and make sure that they have information that they need to be able to visit our various wonderful attractions, restaurants, shops, and everything like that. So we're working hard to get those messages out there in a thoughtful and productive way, and we'll continue to do that as things move forward. So thank you for the opportunity. I look forward to listening tonight and hearing what the community has to say.
Terrific. Thank you very much, Angie. Appreciate that. Next turn to Sumner Schechter, who is with Imagine Glenwood. So Imagine Glenwood's goal is to enhance and protect all neighborhoods in Glenwood Springs and to promote safety and provide an additional voice for residents. So Sumner, let me turn it over to you for 2 minutes.
Thank you. Good evening. Imagine Glenwood was started 5 or 6 years ago by my neighbor Diane Reynolds and me. And as you've heard, our mission is to increase resident participation and voice, like tonight, to engage and interact with decision makers, like tonight, and to enhance the livability and safety of our neighborhoods, also like tonight. And I encourage you to see us and join us on Facebook at Imagine Glenwood, or email imagineglenwood@gmail.com. As I thought about tonight, I look for connection to what we know, to what is new. I compare our COVID threat to the red flag fire warnings that we are so used to here in Glenwood. Glenwood has been existentially threatened and burned by fire at least twice recently. We know the dangers of red flag fire conditions. For the sake of community safety and self-protection, we follow the fire bans and the no firework mandates and the muted 4th of July celebrations. We do it to protect ourselves and our neighbors and our community. If we don't, our well-being and economy would be severely damaged. We would not likely tolerate a friend or neighbor or visitor ignoring our red flag conditions and restrictions. One match face a major threat to health and economy. This is not fake news or some conspiracy. It is a dangerous pandemic. Goldman Sachs just predicted that a national mask-wearing mandate could help prevent renewed lockdowns and economic sustainability. This is Glenwood's red flag warning. Masks, safe distancing, testing are part of our solution to balancing health and economic success. Together, we can find ways to make Glenwood safer and healthier for us and our visitors. Thank you.
Very good. Thank you so much, Sumner, for those cogent thoughts. We have lots to discuss, I think, during the Q&A. So let me turn now for the next 2 minutes to Beatriz Soto. She is the Directora Defiende Nuestra Tierra for Wilderness Workshop. And again, as I mentioned earlier, Beatriz is really helping us think through the issues and considerations that are perhaps the same or different for the Latinx community in Glenwood Springs. Let me just remind people too that if they're listening on the phone and they want to listen in Spanish, they can press *0. Thank you. Beatriz?
Hi, thank you for having me. I also want to mention that I am a founding member and board member of Voces Unidas de las Montañas, which is a new nonprofit that really looks to elevate the Latino voices in decision-making processes. So wearing a little bit of several hats tonight, since I have several hats within the community. Something that Voces Unidas de las Montañas has really been emphasizing is on how COVID is affecting the Latino community. When this pandemic first started, I considered it the grand equalizer, right? Because it didn't affect your social status. It did not affect how old you were, what race you were. We were all going to get the same way. And as has been progressing, we have started to notice national and local data that it's really hitting community and marginalized communities a lot harder, and we're really starting to feel and see the social inequities in our systems and in our communities. And we can even see that here locally, how COVID-19 is truly hitting the Latino community really, really hard. We usually want to see data behind all of this information, and that's a big effort that Voces Unidas de las Montañas is really trying to do, is collect some of this data locally. And we have been surveying the Latino community, and we've had pretty good, and the community is responding. And we are starting to notice that only 50% of Latinos have truly been able to go back to work at a part-time status. Only 2% of Latinos in our valley were really truly employed this whole time, and close to 40-some% of our community are still completely unemployed. So this is something that's really alarming within our community. Our data also shows that some Latinos don't know what to do necessarily if somebody in their family does contact the virus, and how to protect the broader community. And we're also learning that many Latinos aren't necessarily, they don't trust their employers or our local governments, that they have their best interest at heart to make sure that the Latino community thrives beyond COVID, both from a health standpoint and from a economical standpoint. So I'm here to elevate those voices and make sure that we're thinking about our Latino community as we move forward. Thank you.
Great, thank you so much. We'll look forward to hearing, perhaps during the Q&A, you'll be able to bring in some additional data points from the survey. That was very interesting. Let me turn now to Steve Beckley for the last 2 minutes of our opening comments. He's the owner of Iron Mountain Hot Springs and the Glenwood Springs Adventure Park. Steve?
Hello, everybody. Welcome, Glenwood Springs. First of all, I'd like to thank everybody for having me on this panel. It's really an honor to be here. Secondly, I'd like to thank the Chamber and the City Council and the city staff for helping us get open, and specifically the County Commissioners and Tom Jankowski for all his help getting through all the red tape to get our businesses open again. My message today is simple, as I know we have a lot of different viewpoints and a lot of different ideas of what should happen in this pandemic. But the main thing I want to say is that we have to be unified, and we have to work as a town, Glenwood Springs, together to get our businesses kicked off, but also do it safely and do it respectively of each other, and make sure that our message is out there that we're a safe community for you to visit, and get our economy started again. So again, thank you so much for having me, and I'm looking forward to answering any questions or being part of this discussion. Thank you.
Terrific. Thanks so much, Steve. So let's do this. For the next 12 minutes, we're going to hear from Sarah Brainard, who's a nurse and an expert with Garfield Public Health. And then we'll hear from Dr. David Brooks, who is the Chief Medical Officer at Valley View Hospital. And so between the two of them, they're going to cover the landscape of what is the latest, most important data that we need to be paying attention to. And so with that, let me turn it over to Sarah.
Good evening, everybody. Thank you so much for this opportunity. It really is a great forum to be able to speak to people who realize what an important issue this is for our community. So thank you for having me. I would like to talk about our data a little bit. As you may have seen, we issued a press release tonight saying that we're not able to move to our next stages of the protect our neighbors phase. We have to stay in the safer zone because we have had 47 cases reported in the last 4 days. We're reporting out 287 cases as of today for Garfield County. About 40% of those cases are between the ages of 20 and 39 years. And if we look at our demographic data a little bit closer, we're seeing a large percentage of, well, 50% of our cases being Hispanic or Latino. So speaking to Beatrice's point, as well as the demographic of geographic area is quite interesting, with 34% being reported in Glenwood and 22% in Carbondale. So still seeing a number of our cases in the mid-valley, Burr Valley of our community. It's different times and we're learning a lot. We really need to be working with our community, looking at our employment, our essential services where people are continuing to work, and our family transmission. And I think public health is working very hard to try to simplify quarantine and isolation guidelines where the action is the same between quarantine and isolation. The time frames differ. And so would love to have some input on how to encourage our community to really actually follow those quarantine and isolation guidelines, because that's what's going to really keep our community safe and healthy at this point. I would like to turn it over to Dr. Brooks, who has a great presentation ahead with a lot of other data.
All right, thanks, Sarah. I want to start by thanking the city and public health and Valley View, and most importantly, our community for really doing a great job with this very difficult situation. And I'm proud to be a member here, a community member, and I'm proud to work here. Again, I'm David Brooks. I'm the Chief Medical Officer at Valley View Hospital, and I also work on a day-to-day basis as a pediatrician. So I see patients every day, and of course, COVID has captured our attention at the hospital, and I want to spend a few minutes talking about our hospital and then some ideas about moving us forward. So next, you have a next slide, please. So currently, Valley View has tested almost 3,000 people, and just at our hospital, we've had about 129 positive patients, and we've had 29 people admitted, with some others that have been discharged and others that have been transferred out. Currently, Valley View has expanded their testing ability significantly. We now have on-site testing that should last us into the fall, and we're hopeful that supplies will keep coming. And so testing availability is quite broad. We are currently still asking for a physician order or a provider order to get that testing done to keep our supplies appropriate and make sure testing is done appropriately. But the good news is on-site at Valley View testing, so the results are generally delivered within the same day. Next slide. The next slide should show our Tri-County 6-day moving average. And we tend to look at this on a day-to-day basis. And the blue line represents Garfield, the orange line is Eagle, and the yellow line is Pitkin. And what we can see here is over the last few weeks, a definite increasing trend in more cases. We also tend to look at our own internal data at Valley View Hospital. And what you're looking at here, next slide, is the COVID-19 hospitalizations at Valley View. And what we get concerned at is if we have more than 3 new hospitalizations in a week, we start to get concerned about the cases And will we be able to continue to handle and take care of those cases appropriately? So you can see from the graph that early on in March and April, we were reaching that 3 level, and then things got better. But lately, we're starting to breach that 3 patients per week level again. And so we are getting cautious. So because we're getting cautious, I wanted to spend a few minutes talking about reducing the disease spread. And until we have a vaccine or a medication that's going to effectively treat it, we have to focus on what we can do. And what we can do is limit contacts by physically distancing and contact tracing, and reduce transmission probability per contact by wearing face mask and eye protection. So I want to spend the next few minutes focusing on how we at Valley View think about face masks. Now we know that wearing face masks reduces transmissibility by reducing transmission of infected droplets. Face masks protect you, face masks protect me. But let's talk a little bit about the evidence. So recently, the MMWR released a study from the USS Theodore Roosevelt. In mid-January, the Theodore Roosevelt deployed to the Pacific. There was an outbreak of COVID-19 on the ship. 1,000 service members were infected. Most were young, and what the results showed is those that avoided common areas were 40% less likely to get the disease. Those that followed social distancing were 50% less likely to get the disease, and those that wore face coverings were 70% less likely to get COVID-19. Next slide, airborne transmission of the spread. This next slide shows what happened in New York when they instituted social distancing, when they did stay at home, and then finally when they instituted face coverings. You can see on the slide a dramatic decrease in daily new cases when they instituted face coverings. That's in contrast to other parts of the United States that did social distancing, staying at home, but did not mandate the face coverings. And you can see from this slide that the daily new confirmed cases remained unchanged. Next slide. So an analysis of 21 studies showed that masks reduced the risk of respiratory infections by 65%. Next slide. So as we've all started to learn about pandemics and how it affects us, we've learned new language and new terms. Some of us are familiar with a new term called an R-naught. R-naught means how infectious is this disease? How contagious is it? How often does it spread from person to person? So the R-naught for COVID has been debated and discussed, but it's estimated between 2 and 3. Most people estimate it around 2.4. That means each infected person who doesn't do anything to prevent the spread will infect 2.4 other people. So let's take a look at the evidence regarding masks. Masks reduce the R-naught by a factor of 1 minus how effective the mask is times the percentage of people wearing the mask. Now, I'm not going to talk too much about this complicated mathematical formula. This was come up by some mathematicians in China and some other places that did a great job. But let's talk about the effect of masks. So let's just assume that we can get masks that are 50% effective at decreasing the spread, and 50% of the people wear them. So if we do our math, and I'm not going to spend a lot of time talking to people about the math because it is complicated, but the R-naught before the mask was 2.4, and the R-naught after the mask was 1.35. So what does that mean for our community? Next slide. If you started with 100 cases at the start of the month and nobody wore the mask, we would have 31,000 cases by the end of the month. If people wore the mask and our R-naught went down to 1.35, we'd only have 584 cases. That's an amazing difference. And if we pause and think about the cost and the impact to our community of just that change, 80% of those infections that didn't have the mask, of course, will be mild. But some of them will seek care, and we're all paying for that care. 5% will be hospitalized. The average cost of hospitalization when you have COVID ranges from $18,000 to $73,000. And of course, 1% of those may end up in the ICU somewhere, and that cost is astronomical. So if we think about masks just as an economic impact to our community, another study showed that the benefit of each additional cloth mask worn by the public could impact the economy from $3,000 to $6,000. To me, that's an amazing impact of an easy instituted intervention to decrease the spread. So my last statement is masks reduce the transmissibility, masks protect you, protect me, but they also protect our businesses and keep our economy open. So I appreciate everything that everybody's done. I appreciate the community, the hospital, and although we have a long road ahead, I think we can do it together.
Terrific. Thank you very much, Sarah and Dr. Brooks. Very much appreciated those presentations and the updates. So now we're going to enter our public comment and public discussion time for the next about 43 minutes. And so what we want to do is we open up the Q&A as a reminder that if you're on the phone, press *3 if you want to be in the question queue. And otherwise, if you're online, you can see precisely where underneath the player where you can enter your question. We've got a number of questions that have already started to roll in. So let me share some of those with you. So the first question is from Paul, and the question is about consistent mask wearing. And obviously, we just heard a lot about that. So consistent mask wearing in close interactions is the only intervention that is proven yet does not impinge on anyone else's personal rights. What is the objection to face coverings being shared by so many in our community? So that's a question from Paul. Let me actually go to the front line. So I'd love to hear from the business owners in terms of what you're hearing or what your employees are hearing. So let me first turn to Aaron Zielinski, who's the co-owner of Treads. Aaron, what are the kinds of things that you're hearing?
You know, I'll be perfectly honest. My interactions with most of the visitors to our business have not been negative. Most people are perfectly comfortable once we explain to them, you know, what we're asking and putting something on their face. We do have masks available, just the little fabric that you can just kind of put on and disposable. And you know, my staff, to them, I think it gives them a sense of a little bit of personal safety coming back to work. We're just really all happy to be back to work. But in the community, I have sensed quite a lot of reluctance. But it hasn't been much, and maybe that's why, because the people who don't want to put on a mask are staying away. But in our store, I haven't had, once it's explained, people seem to be pretty comfortable with putting something on.
Terrific, thank you, appreciate that. Let me turn to Steve Beckley just to get a different scale in terms of the owner from Iron Mountain Hot Springs and the Caverns Adventure Park. So what kinds of things are you hearing from yourself on the front lines or from your employees in terms of why people might have resistance there? And again, you heard from Aaron, most people are perfectly happy to have a mask on. So
I would say that we have some mixed emotions on this. We've actually had employees quit because they don't want to wear masks and they think it's not necessary. And then on the visitor side, some visitors just won't wear masks, and we ask them repeatedly, and they bring up the idea that they're not required to wear masks if they have some condition. So if they don't want to wear a mask, they say they have a condition, and it's hard to enforce. So those are some of the things we're coming up with. In general, most people don't mind wearing masks, and so we're seeing the high percentages in our parks that will wear masks as they experience our hot springs and the amusement park.
very good. Thanks, Steve. Let's go ahead, and we've got a caller on the line. So Mark is calling in and has a question also about masks. So we'll stay on this theme for just a moment. Mark?
hope that I'm not reiterating what's already been talked about because I was on with your screener and didn't hear all of what had just been said. But a comment and a question. I was in the Sherwin-Williams today and noticed that they have signs everywhere, to have 6-foot distances between the customers and everybody else, which is a good thing. They even have circles on the floor. But 2 of the 3 employees were not wearing masks. So I'm wondering if masks are required in the businesses or suggested, and if they, on either point, what can we do to encourage the wearing of masks? Because as Dr. Brooks pointed out, it makes a huge difference.
And let me go ahead and turn to Angie Anderson first on this. So Angie, I'm just wondering if collectively the business community has talked about this. Is there a high level of understanding of whether it's a requirement or guidance? So any light you can shed on that?
A lot of it has to do with what was included in their Garfield County plan. And employees generally are wearing masks, and I think most businesses are following that. But I couldn't say for sure with regard to what's happening there.
Very good, thank you. And any clarification in terms of it being guidance or a mandate?
And the governor recently came out with employees in certain types of businesses that are required to wear them. I would have to defer to another person in the room, and I think this happens to be, this is where it gets a little difficult, is figuring out the differences between the various orders within the state and the county and the city. So maybe there's somebody on the call that's better apt to answer that.
Anybody on the call can go ahead and give me a signal. Sarah, is that something that you can clarify?
Unfortunately, this isn't my area of expertise. However, we do have people on our team that are very well versed in this and would be happy to follow up with any specific questions. I know they could get that information to Jonathan to clarify. I think the understanding, I know enough to get me in trouble here. The understanding is that part of the variance is that it is required for essential workers to wear a mask. And that was part of one of the initial orders that was issued by the governor. And so I think that exactly what somebody else had previously mentioned, there are some caveats and ways around that if you have a health condition or different things, but there are some guidelines for who is recommended and required to wear masks in a business place.
Good deal. Let's go ahead and circle back to that later in this conversation. We've got a couple specific questions. So John is asking online, what is the positivity percentage for testing today? And how does that compare to Denver? And let me give you just a second one as well, because I think they'll both get bounced to you. So how much detail are we, the community, being given regarding where the COVID-19 outbreaks are occurring in Glenwood Springs? And Lori says, I feel like we have the right to know exactly where the cases are happening so we can keep ourselves safe. So Sarah, Dr. Brooks, do you want to pick up on that one?
Terry, you want me to do the positivity?
Yeah, that'd be perfect. Thank you.
So the positivity rate, at least at Valley View, has been recently around 5%. And so what we're looking for is that positivity rate, as we implement more tests, the positivity rate needs to continue to go down. If we implement more tests, which we have, and the positivity rate remains the same, it simply means that we were missing cases out in the community. So currently at Valley View, our positivity rate has been around 5%. There is a little bit of concern because we've amplified tests recently and it has not fallen. That indicates more disease in the community. As far as public health measures about identifying, I'll defer that to Sarah.
So we're monitoring the positivity rate as well, and we monitor from 3 main testing sites, which include Valley View, Grand River, and Glenwood Medical Associates. And those numbers are reflected on our Garfield County data page. And we actually just started including the specific test positivity rate on there as well. Today, it is 4.2, which exactly like David said, if we can keep it below 5, that's a good sign. I think that we have very good numbers of testing in our community. To date, we've tested about 5,000 people, which is a large percentage of our population. It's nearly 10% of our population. So we do have good testing and monitoring of what actual disease occurrence is in our community.
Very good. And Sarah, while you've got the floor, someone wrote in and asked, Amy did, and said, Sarah, I think you said 47 cases in 2 days in Garfield County. Did you mean 47 in 2 weeks?
I meant 47 in 4 days.
Got it. Very good. Will. Let me go now to Mark, who is on the telephone. He's got a question about whether Polis plans to shut down I-70. So, Mark?
Hello, can you guys hear me?
We can.
Just checking if it's okay. Hi guys, thank you for taking my phone call. Listen, I appreciate the Chamber of Commerce for a financial grant that helped my business. We're just trying to survive this horrible virus. I think it is inevitable that this will explode. This is just trying to protect our well-being in our home tourist town. As everyone knows, summer is rock and roll. I'm just curious if anyone can reach out to Polis to do a 14-day quarantine from out-of-staters, especially those that border Colorado or even Texas, Florida, because I've noticed a lot of tourists, they're trying to get away from the hot, heat, humidity. Those hot spots, they're going to come here, and then we're going to burden the repercussions, and it's going to explode here. Again, thank you very much for you guys' time.
So a question about a period of quarantine or sort of shutting down so people can't pass through. I know that's difficult when you're along the I-70 corridor. Wondering who has Polis on speed dial. Go ahead, Mayor Godis, please.
Yeah, I think that's really difficult. I know I just saw today that 3 northeastern states had required visitors from states like Iowa, my home state, to be quarantined for 14 days if they were traveling to that state. So I think anything that would have to be done statewide and not region by region in the state. And I think that's it's really difficult because there's a lot of interstate travel going from one state to the other. And I think it'd be incredibly difficult, if not impossible, to enforce, and having roadblocks and checkpoints at border stations, I think is, it'd be difficult. So I think that's all I can probably say intelligently about it, but I appreciate the comment and the question.
Yeah, it'd be interesting too. Thank you, Mayor. It'd be interesting too to take comments online or on the phone. There's still sort of a lot of room and a lot of play in the evidence-based recommendations that Dr. Brooks laid out before imagining something like that, which does sound like it would be really difficult to implement. So it'd be great to take some comments there. Let's see. We've got Joyce, who is wondering, to what activities have the recent cases been linked? So I'm not sure if that's for Sarah or Dr. Brooks, but probably a question about contact tracing and what we know about the activities that people have been linked with when contracting the virus.
Sure, I can speak to that. This is Sarah. And You know, a lot of what we were seeing for a time was close contact and close person-to-person transmission. So, index case getting exposed outside of the home and then bringing it into the home and infecting the rest of the household. We have since started seeing broader community spread, and we are not aware of specific incidences where people have traveled. They're not telling us that information anyways, but we are seeing more community transmission and job site, and like I say, those essential workers that have been exposed, and then again bringing it onto their families.
Okay. Very good. Thank you. Let's see. Got a question here from Mary that says, is there a way to tell us how senior communities within the city limits should be protecting ourselves? Several are not wearing masks already and now have 2 cases in my community building. What exactly are the mandates from both the city and the county? So again, this is particularly looking at senior communities. Sarah, Dr. Brooks, is that a question for one of you?
Would you repeat I missed a piece, I feel like.
I think the question is about senior community centers. It doesn't say centers, but it says, is there a way to tell us how senior communities within the city limits should be protecting ourselves? Several are not wearing masks already and now have 2, maybe it's 2 COVID cases, it's a typo, in my community building. What exactly are the mandates?
Okay, sorry, I did miss a piece. And, you know, for our senior living communities, there's not as many regulations as there are for long-term care facilities. The nursing homes and assisted livings have very strong guidance on how to protect those residents. But our senior living, it really is up to the community and the individuals within those communities, much like the rest of our county and the individuals that we are dependent on you to be protecting yourselves. I don't know of a mandate for senior living. However, I did get clarification that there is a mandate for face coverings at places of employment for people who interface with the public. There is a mandate for that. So I wanted to make sure I got that in somewhere.
Yeah, terrific. That's helpful. And let me bounce this one then to Dr. Brooks. So it says, how many deaths in the 29 individuals that were hospitalized at Valley View? What age were the individuals that passed from COVID-19 at Valley View? Should we be focused on a mortality rate instead of on number of cases?
So that's a good question, and I'm unable to share specifics about individuals that pass away, but the data that is publicly available is that Garfield County has had 2 deaths. And what we know without question is that the case fatality rate is hugely different in those over 70. I think the state of Colorado, about 75% of the deaths have occurred over age 70. And so this is a very a virus that we've never seen before. It's amazing that we can have 20% of the people be infected and have absolutely no symptoms, yet at the other age spectrum, we have a high mortality. And so the case fatality rate is difficult to know because we don't truly know the number of cases that are out there. But it has varied, and early on in the pandemic, we thought the case fatality rate was 3%, 3.8% is what the WHO says. The state of Colorado, upwards of 5%. Some other areas were higher. Probably the evidence indicates that the case fatality rate is somewhere around 1%, but we'll never know until we know how many total cases are out there. And the difficulty is those asymptomatic cases that we don't know who has it.
Very good. Thanks, Dr. Brooks. And actually, let's see. Let me ask you a mask question while you have the floor, which is, are there any medical conditions that would be exacerbated by having a mask? And if you look at the online community conversations bulletin board, there were some questions around people who had sensitivities to masks or medical concerns and reasons, and what kind of accommodation there might be in that case.
So although the wearing of masks sometimes feels a little bit uncomfortable, it moves down on your face, you try not to touch it, but you have to try to adjust it. When you have a mask on, there is a slight barrier in the fact that you have to breathe a little bit harder, but the evidence overwhelmingly shows that it has no legitimate impact on oxygen or CO2 levels. Now, of course, there's always extreme exceptions. And I think if somebody had severe pulmonary disease or some other similar condition, that may warrant not wearing a mask. On the other end of the spectrum, as a pediatrician, you try to get a 2-year-old to wear a mask, that's nearly impossible. And so I think there are some extremes that can be excluded. But I think if we're walking around town, the people that are walking around generally can wear a mask.
Very good. Thank you. That's helpful. And that was a question from Joyce again. So I've got a number of other questions, and I'll just mention most of them are in the medical public health arena. So for those of you who are listening and participating online, we've also got a wealth of expertise from the business community. And so invite you to ask questions of the business community, and then additionally, to be thinking about one of the main questions posed by the business community, or that they are wrestling with, is how do we communicate with visitors or people who are passing through our community? So what have you seen work in other communities? What kinds of ideas do you have? Are there ways that we could do that effectively or less effectively? So if you have ideas there, please chime in on one of the mechanisms. Let's see, question here. I think this probably goes to Sarah or Dr. Brooks, but why can't we get tested if we want to versus only if we have symptoms? And just a notation from Siri that other countries have had this available for a while, and why don't we?
David, do you want me to take a stab, or do you want
to? Sure, go ahead.
So the best rationale that I can say right now is that there's so much unknown about asymptomatic transmission that by testing our actual infected people with signs and symptoms, we're able to identify who they could have exposed and have better efforts at mitigating and containing the virus with somebody who's symptomatic than chasing asymptomatic people, because again, there's so much unknown about that. That's my best answer right now.
And I would say that although our supplies of what we call PCR testing, that's testing to see if you currently have the disease, have improved significantly since the beginning of the outbreak, we still have to recognize that there are some limits. And if we were using tests inappropriately such that all asymptomatic people were just coming and getting tested, we would quickly exhaust the supplies we have. And so although our current supplies are much, much better and we can test, we're still trying to focus on a return on the value of that test and identifying people that have symptoms, people that have had exposure, people that need a testing for another reason like preoperative or before a surgery or before a procedure or other important reasons. I'm not sure that we would accomplish much just by randomly testing the people as they came in. I think it would be better to have directed testing and get the answers we're looking for. So maybe at some point we'll have more and more tests available and there'll be an in-home test or a quick test in the office. But at this point, there still is a little bit of limits on supplies, and we have to be cautious of that. We still have a long ways to go.
Thank you, Dr. Brooks. We've got a phone call from Christina, who has a question about cases. Let's go ahead and go to Christina, please.
Hi, can you guys all hear me?
We can. Go ahead.
Okay. Thank you all for meeting today. It's been nice to hear your answers to these questions. I specifically have a question about, I keep reading that when the county surpasses 60 new cases in 14 days, something nebulous is going to be triggered. And I haven't heard what that is. And according to the county's website, we passed 61 cases between June 8th and June 21st. Can somebody speak to what we should be expecting to be happening in the future here?
Sarah, I think that's maybe a question for you.
I can try. So basically, I think the nebulous thing is moving to the next phase. And so the governor's orders for Safer at Home expired on the evening of the 29th. And so with today's announcement of moving into Protect Our Neighbors and Garfield County not being able to move into the Protect Our Neighbors phase is essentially that ramification for the number of cases that were identified in Garfield County. So that's, I think there's not a lot to say that we're going to go backwards on variances. I think that's to be determined about the number of cases that we identify, and the public health director makes those decisions with the Board of Health as well as the governor's guidance. So I think that is still to be determined. But at this point, the biggest decision being made not to allow us to move into those lesser restrictions of the Protect Our Neighbors public health orders.
Thank you, Sarah. And we've got a question here from a business owner. So Greg is asking, due to asymptomatic transmission, it would be great to have a place where Garfield County residents could test without doctor's orders. So again, a question about doctor's orders. All my staff would like to be tested periodically to keep our patrons and our city safe. Is there any way to work towards that?
So I guess the challenge with the testing that's currently available, there's several different types available, being PCR, being antibody testing, even antigen testing. And with all of the various types of testing, they only give us a piece of the puzzle that COVID has presented us with, which is an over 10,000 piece puzzle. And so I think by testing on a frequent basis, it doesn't give us the information that we kind of wish it would, because it's giving us a point in time information. You can be pre-symptomatic, you can be asymptomatic. It's dependent on your viral load. Some people have tested positive and gone through their full isolation, symptom improvement, where they should be allowed to come out of isolation, are still testing positive. And they're not believed to still be infectious or contagious at that point. So I think testing is still, it's not our end all be all with the information that we wish we could get from testing. David, do you have anything to add to that?
I think it's a little bit complicated, and we have to remember that the test that we're talking about right now is called a PCR, and it really is a very sensitive test, but only to a point. So if I'm exposed today and you test me tomorrow, I might be negative tomorrow, I might be negative the next day, I might be negative for the next 9 days, and then suddenly I'll have enough viral replication that it will turn positive. So testing at any one point in time doesn't give you a lot of information. And no matter whether it's negative or positive, you're still in the same boat where we still have to think, I could have it. So I need to keep my social distance. I need to keep my mask, and I still need to be cautious. Maybe someday there'll be a different test that can tell if you have any virus in your system, but that just doesn't exist. And so right now we have to use the PCR test. And if I'm exposed today, it's not going to tell me anything until I'm positive. And so I think that's the challenge. Maybe one day there'll be broad random testing. I personally hope that before we get to that point, we'll have vaccination or some other medical treatment that'll mitigate this issue, and we won't have to rely so much on disease spread to stop it.
Very good. Thank you, Doctor. Let's see. I've got a couple questions here. I just want to remind people too, if they're on the phone and they would like to raise their hand, to press *3. That will get them in the queue. We've got a number of online questions as well. So Christina has said, I've seen some pretty rude interactions between hostile visitors and employees trying to ask them to wear masks. This is a question to the business community. So what help do businesses need to attempt to prevent these interactions by educating visitors? So that's question one. I'm going to throw out a second one from Paula, who said, we've just seen a reversal of bars being allowed to open. What would the business community like to see from the city moving forward to help us continue to open our economy? So I want to throw those to members of the business community on our panel. Let me go ahead and start, if it's okay, with John Bosco, so COO and VP of Hot Springs Pool.
Hi, thank you. Yes, it's a constant challenge. I wish I could say there's a perfect way to do that. We attempt to reach out to our guests who are coming to our hotel with reservation confirmations to explain the the requirement to have masks. We also call them a week or two before they show up to explain that. And I think to the visitors in our town, the lodging community really has to try to be that first notification that you need to be sure to bring your mask if you weren't already thinking that. Even with all of that, there's people who aren't going to read the emails. They aren't going to listen to the voicemails. They're going to just flat out forget it. And in a couple of rare instances, they'll take a political stance that they really don't want to wear a mask. So, as I say, I wish there was the magic bullet to say that we can always tell everybody to show up and expect to wear a mask, but there's going to be some exceptions. We're doing the best we can. And as I say, I think communication is the key.
Very good. Thanks, John. Let me go ahead and turn to Aaron Zielinski. Aaron, anything you want to build off of there?
I think for us, those interactions that have been uncomfortable, we've tried to kind of take an elevated way of being a little bit more obvious in our requests so that it doesn't necessarily have to be a person-to-person request. So I made some additional signs for the front doors. I've kind of given my staff a script to use and, to keep it friendly, keep it respectful, not punitive, not like we're pointing a finger and making somebody feel uncomfortable, because sometimes it's more of just like an ignorance, and they totally would if it were presented in a different way, but sometimes it's made as a demand. And so, we just make an effort to try and make sure that there's no misunderstandings. And, I think that additional communication, I think that putting it on your reservations is great. I think that a lot of the promotional materials that we're putting out for visiting Glenwood Springs, if we can include that, I think that's great. Anything that we can do to make sure that it's not a misunderstanding is going to be incredibly helpful.
Thanks. Appreciate that, Aaron. Let me go ahead and also turn to Steve, and I'll just add, Steve, that Patty wrote in, who said, my employees suggested more signage around town and maybe having a few roaming city folks to talk to people in fun and interesting ways about this. I know people have also wondered about the electronic highway signs, so people know as they roll into town what the situation is in Glenwood. So anything to build off of there, or any different view?
Yeah, sure. This is I think that the face mask is really important, and initially we were being a little bit less demanding, but I think as we go forward, we're going to be more and more demanding, and just to protect our employees and protect other guests. Some of the other things that we're seeing is that social groups, you will get some complaints that people aren't practicing social distancing, but they don't really know that maybe those 10 people are in a social group and they can be together. So we have to be very cautious of judging, who and what people are doing, and we really are trying to wade through a tough, none of us have ever been through this before, so we're still trying to learn and figure out the best way to handle it. But we are going to start taking more and more of a stiffer stance on wearing masks to protect our employees, and really, we make a lot of announcements. We tell people at the front gate that masks are required and tell them the rules, and then we constantly are making announcements and have postings all over the park of what's required, and now we're going to start even more enforcing it in the future.
Thanks, Steve. Let me throw a question to the mayor. So, Mayor, there's a question here about what the city is doing to ensure that our businesses stay open, and to what extent are you in contact with the county, the state, and to support staying open? So what's that advocacy look like? There's also another question I'm not sure if you want to answer it part and parcel or if you're the right person, but question particularly around whether you have constitutional authority to mandate masks.
I'll take the second one first. Yeah, I'll take the second one first. Yes, we do have constitutional authority to mandate masks. That has been challenged, and it's been decided that we are home rule municipality, so our governor has broad powers under emergency orders, as well as our city manager, who we have designated as our public health official to make that order. So constitutionally, legally, we're okay on that. We have been in contact regularly with the state. It's not really a two-way conversation with the state, but we are in regular contact with the county to hopefully find out what they're thinking. They are the public health department for the entire county. They have the experts like Sarah and Yvonne Long, who's the public health director. They have epidemiologists and statisticians. So we're really taking our lead from the county. The authority that we have and that we've exercised primarily has been centered around the face mask order. That order is similar and consistent with our Up Valley communities, Carbondale, Basalt, Aspen, Snowmass, Pickens County, Summit County. When you look at Glenwood Springs, and I know there's a lot of questions on why is Glenwood Springs doing something versus another community, or why aren't we doing something versus another community? And I think you really have to look at what similar community are we? Are we more like a Durango, a Telluride, an Aspen, a Steamboat Springs, a Summit County, where we have tourists and visitors coming from all over the region, the state, and the country? Or are we more like a community like Rifle or Grand Junction? And that is, I think, one of the basis of our understanding of why we enacted very early on a face mask order, was because we felt that with all the people coming into our community, that this is the best way to protect our citizens. As far as other options, right now, yes, we've seen a pretty substantial spike over the last couple of weeks in cases. And I think we would still like to take our lead from Governor Polis and the county public health department before being too aggressive with our plans. But again, that's a council decision, and so I hesitate to speak ahead of my council and on their behalf on this.
Very good. Thanks for that clarification. I'm sure there's more to come on that. So let me go ahead and turn to, we have one last call right now that's in the queue. So Frank wants to talk about the evolution of the virus. Frank, you are live.
Yes, this is Frank here.
Go ahead, Frank.
Since the beginning. Yes, can you hear me?
Yes.
Hello. Okay, this is Frank here. I would like to mention I've followed since the beginning the evolution of this virus. Very close to the news in France, and in the last few weeks, they've done an immense positive result on what they did. They had a very strict confinement rules and wearing the mask and social distancing. And just shows that it works. Here in America, every state, county, city, and everybody is doing different rules, and it doesn't make sense. And when you compare to what works in France and what doesn't work here, this is clear to me that we are not doing the right thing. And this is simple social distancing, wear mask, and it's not few people, it's everybody. If you go in social places, just wear a mask, protect other people and yourself. And just it showed, number shows, France is the country in Europe that's got the most positive results after what they followed for 3 months. And America, we are not. We are going all over in every direction. Everybody does what they want. And it doesn't work. And look, it's going to explode even more. So please, the mask and social distancing is so important. And it works. So why don't we follow it more? Look what works and look what doesn't work. And we should apply our strategies in those directions. Simple, but seems to be very difficult here to follow the rules. And that's all I wanted to say. I hope people hear that, listen to that, and do something about it, because we're not done. And it's going to get a lot worse if we do not the right thing. Thank you. That's it.
Thank you, Frank. I think that's a really important observation that you've made, and certainly some of your recommendations are backed up by some of the evidence that was presented by both Sarah Brainerd as well as Dr. Brooks tonight. So let's see, we have a number of questions, and I want to give you a feel just for the categories of the questions, because we're not going to be able to answer all of these tonight. So good news is that we will have future community conversations if there is interest in that regard. So let me do one last question, and then I'll give you some categories so we can think about that as we move into closing comments. So there's a question from Janice that says, what messaging can occur from you as business owners, city and community leaders, and let's see, and as city members to support our public health department to cooperate with contact tracing, isolation, and quarantine, and when an individual receives a positive test result? And let me actually, let me send that to Sumner. I'd be curious about your thinking on this. So, because I think sometimes the neighbor to neighbor dialogue is the one that is most effective and powerful. So any ideas on how to support the important messaging that needs to happen right now?
For the neighbor, people, particularly some of our more vulnerable senior citizens, have been getting help from family and neighbors doing grocery shopping and getting goods around town. I think if I understand the question correctly, I don't have a clear answer, but if we're talking about subsequent now, more isolation and quarantining, it seems to me we might want to consider a more coordinated approach. We have quarantine support teams. If indeed we are testing to the point where we're requiring people to isolate and quarantine, maybe that would be one other thing that the community does, that people are willing, that we put together some kind of quarantine teams that can support those that for all of our benefit are forced to isolate. And so that's about all I have at this point. You've just triggered, I think, a new idea.
Terrific. That's part of what a conversation and a dialogue should do. So that's great. Let me give you a couple ideas of the other categories, because we're not going to be able to get to all of these great questions tonight, and I'm loving seeing this kind of participation from Glenwood Springs. It's awesome. I wish we had 2 more hours. So there are sort of a bucket of questions around authorities and enforcement. So there's questions about that, particularly in regard to face coverings and masks. There's sort of another bucket of questions that's around specifics of numbers and how old people were who contracted the virus, what the trends, more about the trends of the younger people who are also contracting COVID-19. So there's some questions to that effect, questions about mortality. There's questions all the way to the range of when might we be able to have 200 person weddings and funerals. So an entire range of questions. What I'd love to do now is move to some closing comments. Want to give you that food for thought as we move into some closing comments by the 4 remaining community members. And Beatrice, I want us, I'd love to start with you because I know you've been listening really carefully to everything that's been said. And we additionally have a question here that says, as a community, how can we improve trust and confidence within the Latino community? We're all in this together, so how can we work better together? So a question from Stacy there, and I wondered if you had some reflections on that. So Beatrice, with your permission, I'd love to go to you first.
Absolutely. Thank you. So I think this is really an on look at how our community interacts with each other, and that there is a lot of work to do and move forward. When COVID, our community, my first concern was, how are we going to make sure that information is culturally appropriate, it's getting to the right place in the right language, knowing that a lot of our infrastructure isn't ready to do that, and we're such a big part of the community, and we're such a large demographic. What I would really wish is, let's push through, COVID-19, come out of this strong, together, resilient, and then continue to work together to make sure the next time we have an emergency, we have a health, any type of unpredicted circumstance, that we're ready, that we have this, our relationships are strong, and that we community and everybody's acknowledged in our community, and we are trying to understand each other and allowing Latino community members to find solutions for our own community, and that we can really interact in a very meaningful way, versus trying to just make sure that, we are all like into this melting pot. It doesn't really work that easily, but more recognizing our differences and making sure that we are strong and we're going to be resilient. That would be my suggestion.
Indeed, very, very well said. Thank you so much. Let me turn to John Bosco now. So again, COO and VP of the Hot Springs Pool. John?
Okay, thank you. And thanks for inviting me to participate tonight. This is really important and great dialogue. So the Glenwood Hot Springs, on the advice of state, county, and city authorities, chose to support and enforce the mask requirement for all of our staff and guests upon reopening on June 8th. But in consideration of this, we had to take into account a lot of factors like the health and safety and even the financial well-being of our employees. We had to get open, the health and safety of our guests, local, regional, and statewide communities, the ability of our business just to survive economically, not just this summer, but we got to make it through the fall, winter, and spring, and for another 133 years. This could be a very tough off season this year for a lot of small businesses in this county. So we got to do this right, especially now. In April, we applied for and received and spent the federal financial assistance to help pay our employees while we waited for permission to open. And there's not, at this point, another financial assistance package waiting to rescue us again. And unemployment insurance can't last forever. Small businesses are really on our own this time. So we got to act now collectively to curb the infection rate in order to keep our businesses open albeit at substantially curtailed levels. So in my opinion, the act of wearing a mask as a preventative health measure is not much of an imposition if you compare it to the potential for serious illness or loss of life, but also to the consequences that another shutdown would bring to the local business community and their employees. So I'd like to thank the City of Glenwood Springs, them and the Garfield County Public Health, Valley View Hospital, and our county commissioners, especially Tom Jay, as Steve mentioned. They spent an enormous amount of time on these issues, and we here at the pool would like to extend our gratitude and our appreciation for that. We'd also like to thank our guests and our members and our employees for understanding that for understanding our condition here and the patients regarding our modified, what our normal operations are now. Nobody wanted to get to this point. But if we do it right by working together and out of consideration for each other, maybe someday soon we can all begin to move closer to where we were a mere 3.5 months ago. So again, thank you for your time.
Thank you, John. I think we would all look forward to that day. Appreciate that. Let me go to Aaron next. So again, Aaron, tell us from the small business perspective, please reflect on the conversation you heard and offer if you think it's a little different from your lens.
No, I think, in listening to everybody, I think that what I hear is just a lot of honest concern. There's a lot of concern for the future, a lot of concern for personal safety and wellness, concern for our neighbors, concern for, the very foundation of our community. And, one word that popped up and kind of highlighted for me is trust. We need to trust each other. My patrons need to trust me that I care enough to create the cleanest, safest environment that I can. I have taken enhanced measures. I see it all around town. It's talking to each other, understanding where people are coming from, recognizing that our city and community leaders are just people. They're people that are dealing with something that is fairly unprecedented, and we're all doing it the best, and we have to trust that, the higher purpose is everybody's survival, whether that be fiscal, whether that be, actually your very life. And so, moving forward, I think communication and patience and understanding is going to be vital, just maybe even more so than the actual things that we do, like wearing a mask and washing our hands, because unhappy people don't create a strong, vibrant community. And really, I think that trust and that kind of confidence in each other is going to be just as important as all the other hygienic measures and things that we're doing.
Thank you so much, Erin. Those comments, I think, have really resonated with people. I can see some of the online chats happening, so appreciate that. I want to turn to Mayor Godis in a second here, but also just want to pick up on a couple additional themes. So one is this pretty specific question, and Jonathan, maybe you'll pick up on this in your comments, but there's no Colorado law. This is a question from Nick. That mandates the wearing of any face covering, which impedes breathing. Businesses that refuse service to any individual that doesn't comply are breaking state law 24-34-601, discrimination in places of public accommodation. So that is a hefty question and an important one. So I want to make sure that we get to that. And again, lots of additional buckets of questions that also talk specifically about masks and face coverings, particularly Dr. Brooks, people who are also interested in digging into the data you had of, what kind of were in that study. Did they look different than others? So all conversations I hope that we can pick up in the future. This is not your only opportunity. So there will be future conversations. We did plan for 90 minutes tonight and want to honor people's time this evening. That being said, and I think Mayor Godis will probably speak to this, but they also additionally will be picking up the issue of face coverings at the City Council meeting on Thursday. So with that, let me turn it over to the mayor.
Yeah, thank you, Jess. Yeah, to the next question about, I guess, again, the legality of it. Again, we're a home rule municipality, so we do have the authority to mandate face masks. The state does not require them yet, but here in this community, we do. The last vote we took was a 7-0 vote on council to extend the face mask requirement to our Thursday evening meeting. And I think this speaks of a broader theme. When Kennedy had the space program to get us to the moon in the 60s, there wasn't this huge debate in this country whether we should go to Mars, whether we should put more satellites in orbit. It was one focused goal to get everybody on the moon. And I think that that's what I would like to see for this community, that consistency in buy-in, in messaging, in enforcement, in helpful reminders. There is consistency from Aspen to Glenwood. There is consistency in most, if not all, resort mountain communities that face mask is something that is a mandatory covering. And so, I know there's a lot of questions and concerns about it. I think, Dr. Burke could talk about it, and we can talk about it at some point, but he has spoke that it is not something that inhibits a healthy person's breathing. And so for those reasons, and because it has just shown that it works, science has shown that this is something that does help and that does work. And I think that, I guess I would call it our business community to be consistent and can be strong in the messaging, because what's worse is when somebody goes, a visitor or a resident goes to one business like Sherman-Williams that was mentioned earlier and sees staff not wearing a face covering, which is a state order, by the way. That's not a Glenwood Springs order. And then goes someplace else and sees that it's being unequally and unevenly applied. And I think that's what causes confusion with residents and visitors alike. So I think having a strong business community that has a strong messaging is really helpful. And I think that, I just want to, conclude and say, I just want to thank everybody for participating tonight, for participating at city council meetings. Our city council meetings are online. And, those are all options and opportunities for people to come and let us know what they're experiencing, whether they're business owners, whether they're in the medical field, whether they're residents or even, yes, visitors. And we are listening. This is what tonight's about. This is what city council meeting public comment is about. We want to hear what you're saying. And I know it seems like we aren't listening to your concerns, but please understand that we are. And we're trying. We're trying. And if we haven't, and if I haven't, I do want to take this opportunity to apologize for that. I'm just really proud of this community for being really brave enough to have this discussion. And, together I know that we can overcome this COVID-19. We might not always agree on the best way and the best path forward, but this is something that I know we can all do together. I know, again, face coverings is a lot of the questions tonight, a lot of questions, a lot of intellectual curiosity on what 60 people mean. And I guess I would say that's another thing is public health has a motto. It's more masks, more distance, more business. This is a pro-business message. We want to keep our businesses open. We had another commenter talk about what would happen when we hit the 60 number. Well, we're high. We've been spiking the last couple of weeks, so we don't get to move into the next phase, which is protect your neighbor, which would allow for us to have gatherings of up to 500 people, funerals, weddings. It would allow us to be at 50% pre-COVID levels for capacity on many of our businesses. We don't in Garfield County get to move to that stage because of our numbers. And conversely, while it's not likely we move back, we just saw today Governor Polis has rescinded his order that allowed for bars and nightclubs to be open. And those are now shut down as of today for the next 30 days because of the statewide numbers. So we're in a precarious spot where we need to all do everything we can to keep our businesses open, to keep our economy going, to keep individuals healthy, to keep our neighbors safe, to keep ourselves healthy. So that's my call to everybody, I guess, on the call tonight. I really want to thank our panelists who've given generously of their time and have been a voice for health, for the economy, for business. And I just want to thank you very much, and thank you very much, Janess, for facilitating this.
You're very welcome. We're at the top of the hour, and I just want to say, just echo what Jonathan said. So a huge thanks to those of you who participated in all kinds of ways. There was a huge response online and on the telephone, and look forward to continuing the dialogue. I'll tell you this, I work with a lot of communities in Colorado, in the United States, and around the world, and healthy communities have these kinds of conversations, the really hard ones, that are about the intersection of just what you're discussing today. So values and what do we want and who do we want to be and how do we want to show up for each other. So really, really impressed, and just a huge thanks to everyone. Everybody have a good night.